Well, hello again, friends. More feedback, more inspiration, more questions. Back again, same day, some more recording. Let's tackle a few more questions and answers. I have a few minutes that I can devote to this practice. Let's try it again. Let's try some more. Keep your comments coming. Keep your requests coming. Please share, like, subscribe. Very important for the maintenance of this channel. I truly appreciate it. Let's try to make this a big deal in the sterile processing community. I'm here for you, and I know you're here for me. Let's get busy. Next question. The packaging area is for inspecting, assembling, and packaging. Which of the following items? The packaging area is for inspecting, assembling, and packaging. Which of the following items? Is it sterile items? Number one. Items that have been repaired, 2, 3, recovered items, and 4, clean items. So let's examine this briefly. Packaging area, well, also known as the assembly area, preparation and packaging area as well. We're talking about the items that just came out of the thermal disinfection units. I mean, technically, it should be disinfected items because that's basically what they are. But this is not one of the options, so we have to go with the next best thing. So are the sterile items there? Obviously not. So the answer number one is out. Items that have been repaired. Well, yes, but as we know, the repaired items need to go through decontamination first. Number three, recovered items. I don't know what they mean by that, so I'm pretty sure that this is out. And last but not least, number four, clean items. I'm going to go with clean with number four because the rationale there is either disinfected or clean, because that's what this area is designated for. So the answer here is clean items, or items that you can touch with your bare hands. Technically should be disinfected, but this is just the type of a question, and we take the best possible answer. Next question. As part of the job of a central service technician, work-related problems are identified and solved. This is known as, this is from my favorite chapters in the book, where we discuss quality, inventory management, human relations, and so on and so forth. This is where we find it in the last chapters of the Sterile Processing Manual. Let's take a look. So as part of the job of a central service technician, work-related problems are identified and solved. This is also known as number one, process improvement. Number two, quality assurance. Number three, leadership. Number four, quality control. Okay. So number one is process improvement. Number two is quality assurance. Number three is leadership. Number four is quality control. If you guys remember what quality is, there are two answers here that address the word quality. Quality is the consistent delivery of goods and services. Consistent delivery of goods and services to assure patient care. Nowhere in this question are we talking about consistent delivery of goods and services. We're talking about work-related problems. What could that be? Well, is it leadership? Well, no, it's not a process. They're looking for a process. So the only thing here is process improvement. I'm going to go with that answer. So process improvement is an activity to identify and resolve work-related problems, to find root causes so they don't happen again, that sort of thing. That's what it sounds like the answer here. I'm going to go with number one. Let's go to the next question. Okay. The shelf life of packaged sterile items is interesting. They're either looking for a date or what constitutes sterile once it is placed in the package and on a shelf somewhere in sterile storage. So the shelf life of packaged sterile items is 1 month regardless of any event. 2 months from the time it was received. 3 2 months from the time processed, and 3 it's event related. Sterility is event-based. What is an event? Event, if anything possibly happens to the instrument set. you carrying it in your hands, which you really ought not do. Remember, transport of an instrument set, no matter where, has to be done in a stainless steel container or cart with closed doors and a solid bottom. So you don't want to bump into anyone or anything, forcing the air in and out, or just dropping the, or hurting yourself. We don't want work-related musculoskeletal disorders, WMSDs, to take place. Even the lightest of containers create problems. We don't have dates on our packages. We have Julian dates, but that has nothing to do with sterile or not sterile. So we want to focus on event. So therefore, the answer here is event-related or event-based. Sterility is event-based, unless you have a different policy in your department. But in this case, that's not what it is. Let's go to the next one. That one was easy. All right, let's see if we can tackle another good one. In terms of patient care equipment, which of the following would be an appropriate safety tip? Patient care equipment, remember, pumps, beds, EKG monitors, those things, mostly pumps, all right? They are electrical items with batteries. Let's look. Let's look at the question one more time. In terms of patient care equipment, which of the following would be an appropriate safety tip? All right. Number one, assure that nothing is placed over items such as heat lamps during transport. Next, number two, ensure that the facilities administration department assist with equipment acceptance and regular testing programs. Three, test and document all patient care equipment when it reaches the patient. And last but not least, cover contaminated equipment that is being transported to the Central Service Department for processing. Okay, let's look at the question one more time. Assure that nothing is placed over the items such as the heat lamps during transport. So in terms of patient care equipment, which of the following would be an appropriate safety tip? Assure that nothing is placed over items such as heat lamps during transport. Is that really a safety tip? Not sure. Ensure that the facilities administration department assists with equipment acceptance and regular testing programs. Not a safety tip. Next, number three, test and document all patient care equipment when it reaches the patient. A bit late for that, and it's not safety. Last but not least, cover contaminated equipment that is being transported to the Central Service Department for processing. Biological hazard, contaminated equipment. Cover it up when transporting to avoid spills and so on and so forth. Steve's choice, number four. Cover contaminated equipment that is being transported to the Central Service Department for processing. Next. All right, let's try this one here. The consistent delivery of products and services according to established standards is part of, oh, please. What did we just have just a few moments ago? I don't even want to look at the answers. The word quality has to be present in the answer. How many times did I repeat myself? That consistent delivery. Okay, quality equals consistent delivery. Of what? Administrative efficiency, number one. Two, sterile storage. Three, quality assurance. Ooh, the word quality is in there. Number four, maintenance and repair standards. Nothing to it. It's quality assurance. Moving on. I think the rationale is pretty clear with that one. So let's go on to the next question. And so, which of the following personnel is responsible for ensuring that patient care equipment is readily available when needed? It's like a trick question here. Which of the following personnel is responsible for ensuring that patient care equipment is readily available when needed? I say it's a trick question because it's all about the sterile processing department, right? So I am going to assume that sterile processing technicians are part of this answer here. So point of view staff. Who is point of views? That's surgery, friends. I'm going to chuck that one out. Next one would be central service technicians. That's number two, central service technicians. I'm going to put a big Yes on that one so far. Number 3, biomed technicians. And then clinical engineering department. By the way, biomed, number 3, clinical engineering, they're one department. They're just different names. So they're throwing us a little piece of red meat here, even though you could confuse it with biomed or clinical engineering to answer this question. But the only one that truly stands out for being responsible for the equipment to be readily available, that would be us. The other folks, even though they do preventive maintenance and repairs and so on and so forth, they're not the ones that make it readily available. We are. We do. So the answer here, number 2, central service technicians. Onward to the next question. Here we go. Now, which one will be a good one? Which one will be a good one? All right. Which of the following is the best way to clean electrical medical equipment? My dear friends, there are so many right ways to clean medical equipment, but there's always only one that stands out, and that's the one that the manufacturer provides for you. I'm not even looking at this question. I know that OEMIFU, or follow original equipment manufacturer's instructions for use, must be the right answer. Otherwise, you would have a million possibilities here. But let's take a look at the answers. So which of the following is the best way to clean electrical medical equipment? Numero uno, referring to the institution's instructions for cleaning items. Sounds reasonable, but not. Number 2, referring to the manufacturer's directions. Ding, 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 ding. The other one's with the spray, the other one with a wet cloth. Well, both are incorrect unless that's what the manufacturer said. So the correct answer here, as always, OEMIFU. OEMIFU, the most important 6 letters in the entire book. Follow original equipment manufacturer's instructions for use. Thank you. Moving on. Okay. Which of the following is a piece of patient care equipment that artificially stimulates the venous plantar plexus? Interesting. Which of the following is a piece of patient care equipment that artificially stimulates the venous plantar plexus? Jeez, that's a tough one. To be honest with you, I haven't seen a reference to this type of a question specifically in the book. But let's look at the possibilities. We're obviously talking about patient care equipment. So what exactly is plantar? Well, plantar surface in reality refers to a foot. We have a dorsal and a plantar surface of the foot. If you're looking in the anatomical chapter here in the manual, you will actually find these surfaces over there. So even though there's not too many questions here, as I tell people, remember, no word left behind. All right. So let's check out if you know what we have here. We're making an educated guess if you're like drawing a blank here on the test. I mean, who wouldn't? It's a fairly specific piece of equipment. So first option is number 1, infusion pump. No, we're not infusing anything because this thing is artificially stimulates the venous plantar plexus, whatever the heck that is. The next one is foot pump. Foot. Sounds good. Let's look at suction machine is number 3. We're not sucking anything. And suction regulator, for sure not. The only thing that fits here with an educated guess is the foot pump. Number 2, Steve's choice. Let's do one more or 2 more. Let's see how it goes. All right. Some meat and potatoes at last. The 300 series of stainless steel is used for all but which of the following types of patient care instruments? I got to tell you, I'm getting these questions off the internet, and a lot of them are just plain old incorrect because we don't use 300 series steel or any kind of steel really on patient care equipment. It should state surgical instrument. So let me rephrase the question. The 300 series steel is used for all but which of the following surgical instruments? Rephrasing the question. The 300 series steel is used on all but which types of surgical instruments? Number 1, retractors. Number 2, needle holders. Number 3, cannulas. Number 4, suction devices. All right. Reminder, dear friends, we have two different types of stainless surgical steel, 300 series steel and 400 series steel. 300 series steel is softer, 400 series steel is harder. 400 series steel is used on instruments that cut, clamp, and sew. Cut, clamp, and sew. You know, needles, clamp, hemostats, needle holders. Ding, 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 ding. And softer steel can be used on things that suck, blow, and retract, like various cannulas, okay, for air or suction. And retractors don't really need to cut anything. They just hold back tissue. Yes, they do use 400 series steel on them sometimes, but most of the time, 300 series steel is more than enough. But the question is, which one other than? So we have retractors, cannula, suction devices, and needle holders. Needle holders must be hard. 400 series steel used on that only. So that's my answer here. Needle holders. Answer number 2 is anything but needle holders is for 300 series steel. Let's do one more question, and we'll call it a day with this one. The personnel responsible for ensuring that patient care equipment is readily available. Oh, sorry. My apologies. Steve is going slightly senile. Hopefully not until you pass the exam. Okay. Let's go to a different question. I already did that one with you. Parallel grooves in the jaws of surgical instruments are also called what? Parallel grooves. You know, not diamond shaped, but parallel grooves. What are they called? Are they called retractors? Number 1, retractors, rongeurs, serrations, or ratchets. My dear friends, I want to remind you to please take a look at the anatomy of the hemostats in the book. Okay, they show you great pictures. Retractor is an instrument, so it's not just the grooves. Okay, so we're gonna bump that one out. A rongeur is an instrument, okay, which a rongeur, the word rongeur, it's that weird spelling of an instrument. Rongeur, which means a rat. It bites bone and tissue. Okay, that's an instrument. So we're going to bump that one off. The next word is serrations, number 3. Yes, serration is it, because the next one is ratchets. Ratchets are, lucky for us, I have this here in front of me. I have ratchets. If I can show them to you here, if you can see them, that would be the ratchet over there. Okay, and the serrations are inside the jaws here. Okay, so that's the stuff. The answer is 3. Serrations. What the heck? Let's do one more. I'm feeling enthused and empowered by your desire to learn. Again, keep those comments coming. Make sure to hit the subscribe button. Make sure to share with your friends. The more, the merrier. We need every bit of support from YouTube to make sure that these videos reach our targeted audience, which is the people who want to be certified central service technicians. Everyone in the field must be certified. It is extremely important for all of you out there so you can make more money and improve patient care. Remember, everything we do is patient-centered, and the certification is key. Certification is key. I've never been the one for certifications, but this is important. Get this done and get the rest certifications too. Do the endoscopes, do the healthcare leader course, do the CIS, certified instrument specialist. The more paper, the more numbers you have, the more initials you have, the more money you make, the better patients are fair. Remember, sterile processing technicians are responsible for 60%, for more than 60% of revenue collected by the hospital, because what we do allows surgery to make money for the hospital and prevent death, dismemberment, disfigurement. We do great work, and don't forget that. Last question for now. The system of healthcare providers and organizations which provide a coordinated range of services to a specific population is which of the following? Yeah, it's one of those obscure questions, but let's take a look. Let's read the question one more time. Don't dwell too much on this type of a question, but they do sprinkle them in there somehow. Let's see what the new test will bring. The system of healthcare providers and organizations which provide a coordinated range of services to a specific population is which of the following? Is it the case card system? Is it the patient services? Is it healthcare cooperative? Or is it integrated delivery network? I'm going to make an educated guess because case card system doesn't fit here. Patient services doesn't seem to, get in there. Healthcare cooperative seems a little bit like, well, it's not. But integrated delivery network seems to comprise the right language to answer here. So out there, in response to growing demand for reprocessing services, some facilities have considered services into an entire integrated delivery network, or IDN. Uh, so this is where we are. Okay, let's take that as rationale. It sounds like the right answer. This is Steve's pick. Well, I think that'll do it for this segment. Waiting to hear your comments and referrals. I appreciate everything. Keep up the great work, folks. Recommend this channel to everybody. Hit the likes. I can't stress this enough. This like business on YouTube creates algorithms that make this program more accessible to more people. We want this to get into the right places. Hit those like buttons. Hit the shares. It doesn't matter what, to whom, even to people who don't necessarily need it, but spread the word. Spread the word. Let's do right by others too. I know you're here, but let's get more people on board here. See you soon.